Good morning and welcome to the George Washington University School of Public Health and Health Services. I'm Lynn Goldman, the Dean of the school. We are so pleased to host this event at GW on behalf of our school. The goal of preventing heart attacks and strokes through education, helping Americans make better choices, and providing improved care is important. There is great value in using what we already know to save lives, as well as doing research so that we can learn more. Each year, thousands of people suffer from heart attacks that could be prevented, and we are so excited to learn about this new public-private partnership that will have a positive effect on the lives of so many people in this country. It is my pleasure to introduce you to the important leaders who will tell us about this great initiative. These leaders include Secretary Kathleen Sebelius, the 21st Secretary of the Department of Health and Human Services, Dr. Tom Frieden, Director of the U.S. Centers for Disease Control and Prevention, Dr. Don Berwick, Administrator of the Centers for Medicaid and Medicare Services of HHS, Nancy Brown, who is CEO of the American Heart Association, Kermit Crawford, President of Pharmacy, Health, and Wellness Division, Walgreens, Jonathan Lever, Executive Vice President of Strategy and Innovation from the YMCA, Reed Tuckson, Vice President and Chief of Medical Affairs from United Health Group, Tom Menigan, Executive Vice President from the American Pharmacists Association, and Robert Waugh, Chairman of the Board of Trustees of the American Medical Association. Thanks so much to all of you for being here today and bringing this worthwhile campaign to our campus and to our country. So it is now first my honor to introduce Secretary Kathleen Sebelius, the 21st Secretary of the Department of Health and Human Services. Secretary Sebelius has led ambitious efforts to improve America's health and enhance the delivery of human services to some of the nation's most vulnerable populations, including young children, those with disabilities, and the elderly. As part of the Affordable Care Act, Secretary Sebelius is implementing the reforms that will help 34 million uninsured Americans get health coverage. She is also carrying out policies that put a new focus on wellness and prevention, support the adoption of electronic medical records, and help recruit and train more primary health care providers. Secretary Sebelius is committed to ensuring that America continues to lead the world in innovation. Under her leadership, HHS is promoting public-private collaboration to bring life-saving treatments and medicines to market. The department is also working to build a 21st century food safety system that will prevent outbreaks before they occur. Let us welcome Secretary Sebelius to our podium. Thank you for being here.
Well, thank you very much, Dean Goldman, for welcoming us back to GW. We seem to make all the best announcements here, so I'm thrilled to be back, and thank you for your leadership in the health field. I want to also thank our outstanding partners on the stage today for joining us. We have more in the audience, but not only for just being here today, but for their partnership and commitment to this critical initiative. With 2 million heart attacks and strokes a year and 800,000 deaths, just by about all of us have been touched by someone who has had heart disease, a heart attack, or a stroke. Heart disease takes the lives of far too many people in this country, depriving their families and communities of someone they love and care for, a father, a mother, a wife, a friend, a neighbor, a spouse. Each loss deprives our society of their fullest contribution, their creativity, and their productivity. And I know that sense of personal loss because my mother is one of those statistics. This is particularly tragic because we know that most heart attacks and strokes can be prevented with simple, low-cost care that's available to us today. But the sad truth is, too many people who need that preventive care don't get it. So a major goal of this administration is to change that for the better. Now, this isn't just a human tragedy, it's also a huge drain on our economy. Cardiovascular disease costs our nation $444 billion each and every year in medical costs and lost productivity. That's $1.2 billion a day that we're losing. Treating heart disease and strokes accounts for about 1 out of every 6 healthcare dollars that we spend in this country. So we're paying much too high a price, and together we must and we can do better. So today we're launching an initiative that we're calling Million Hearts, which is a joint effort by leaders in the public and the private sectors to address this critical need. By improving prevention and improving care, we have a goal to prevent 1 million heart attacks and strokes over the next 5 years. Now that's an ambitious goal, and it's an ambitious initiative, but it's so very necessary. Achieving our goal will be both easy and hard. It's easy because we already know the key steps we can take to improve our nation's heart health. We call them the ABCs. That's aspirin, A, to prevent heart attacks for people who need it. B, blood pressure. C, cholesterol control. And the S comes from quitting smoking. ABCS. We also know the importance of empowering Americans to make healthy choices, such as improving nutrition and reducing excess sodium, a major contributor to high blood pressure. The goal is hard because focusing on prevention means focusing on things that don't happen. When prevention succeeds, it's invisible. But we're making it a focus of Million Hearts because we know that the most effective way to save lives lost to heart disease and stroke is to prevent them from happening in the first place. In several ways, we're already working to improve care that people receive so that patients can spend more time with their doctors, so that caregivers can work with each other to provide the best care. Million Hearts builds on these efforts. Within the federal government, the effort will be co-led by 2 of our great healthcare leaders, Dr. Tom Frieden, who runs the Centers for Disease Control and Prevention, and Dr. Don Berwick, who runs CMS. And you'll hear from both of them in a few minutes about the steps their agencies are already taking. I'm also delighted to recognize Dr. Janet Wright, a distinguished cardiologist who has been selected to lead this initiative. Dr. Wright is joining us from the American College of Cardiology, where she's been the Senior Vice President for Science and Quality. Dr. Wright, would you stand up and let us thank you for your efforts. Our whole department is putting its weight behind Million Hearts. But I want to stress that our commitment is just one part of this campaign. Today, many of our partners are joining us, not just to endorse Million Hearts, but also to help lead it. By bringing their ingenuity, their resources, their leadership to this effort, we have a much greater impact than if the government acted alone. So I'm grateful to all the private sector leaders who share the stage today, and I want to call on others to join our effort. We've had the science and the tools to fight heart disease and stroke for a long time. Today, we have an unprecedented commitment from partners across government, across society, to put these tools to use like never before. Million Hearts is a change in how both the government and the private sector will deal with heart disease and could literally save your life or the life of someone you love. Now, I want to kick off our program by sharing a very short video. As we launch Million Hearts today, it paints a stunning picture of just what's at stake.
I spent 10 days in the coronary care intensive care unit, and during that time, I lost a baby.
I was pretty healthy, I thought. Obviously, that proved not to be the case later.
Luckily, my wife called 911 immediately.
And I felt like somebody was going around turning systems off.
I was hot to the point of wanting to crawl out of my own skin.
I was literally gasping for breath.
Little did I know that that was just the beginning of my stroke journey.
I consider myself to be in the bonus round, and it reminded me of just how fragile life could be.
Be educated about your risks for heart disease and heart attacks, as well as listen to your body.
Going to my daughter's graduation.
Playing with my dogs.
Spending a lot more time with my grandkids. Me.
Me.
You.
Thank you very much, Secretary Sebelius, and all of our very distinguished partners for joining us today. Cardiovascular disease is a big problem, and Million Hearts is a big solution. It's the right solution for our times. It's one that won't require a lot of new spending. It focuses our efforts so we can get the most possible health value from the precious resources and harness the power of doctors and other healthcare providers, information technology, communities, and private sector partners. We'll reduce the number of people who need treatment to prevent heart disease and stroke through prevention and improve the quality of care for those who do need it through quality improvement and focus on the ABCs. Despite the hard work and steady progress of many partners, as it is today, less than half of Americans who should be taking an aspirin a day are taking one. Less than half of Americans with high blood pressure have it under control. Only 1 out of 3 Americans with high cholesterol are effectively treated, and less than a quarter of Americans who smoke get help to quit when they see their doctor. By improving and simplifying reporting on the ABCs and working to align these measures through public and private systems, we'll help doctors and healthcare organizations and patients focus on the most important measures to protect them from heart attack and stroke. Information technology has come together and can now provide effective tools for prevention and care for those who need it. A lot of us get notes from our dentist or our auto mechanic or our veterinarian when our teeth or our car or our pets need care. But far too few people whose hearts are at risk get reminders from their doctor's office or their organization reminding them to come in for care. Health information technology has the ability to revolutionize the way we prevent heart attacks and strokes through improving clinical care and getting those ABCs numbers up much higher than they are now. We'll also work to identify innovative approaches using team-based care and involving every member of the healthcare team to their fullest potential. We'll also work to prevent heart attacks and strokes in the community by reducing smoking, which remains the leading preventable cause of death in this country. 70% of smokers want to quit, and we can provide assistance and information to activate communities, pack warnings that the FDA is going to require or has required for the cigarette industry, and community education so there's better awareness. Artificial trans fat has been reduced by more than half through the voluntary efforts of the industry. That's excellent and important progress, and we'll work with the industry on further progress in reducing artificial trans fat. Sodium. More than 80% of us consume too much sodium, and that is generally what's in processed and restaurant foods, not what we add in the kitchen or at the table. In fact, what we'd like to do is work with industry to establish a voluntary approach to gradual reductions in sodium so that you can decide how much salt to put in your food, to put control back into the consumer's hand of how much sodium to put on their food. There are many partners who will be key to the success of Million Hearts, and every individual can play a role. You can take simple steps to protect yourself and your loved ones from a heart attack or stroke. Find out from your doctor if you should take an aspirin every day. Find out if you have high blood pressure and high cholesterol, and if so, ensure that you're effectively treated. And if you smoke, get help to quit. With the Million Hearts initiative, over the next 5 years, if we reach our goals, 10 million more Americans with high blood pressure will have it under control. 20 million more Americans with high cholesterol will have effective treatment. 4 million fewer Americans will smoke. Consumption of artificial trans fat will be cut by half, and of sodium by 20%. This is a commitment to prioritize and to hold ourselves and our communities accountable for preventing the leading cause of preventable death in this country, and to use all of the dedication, ingenuity, and collaboration we can from both government and private sectors to succeed. I'm confident that working together, we can save 1 million hearts. And I'd now like to turn it over to my colleague, Don Berwick. It's been a delight to work with him and his organization in the development of this initiative.
Thanks, Tom, and thank you, Secretary Sebelius. I can't tell you what a pleasure it is to work with these great leaders, enormous vision, translating science now into action, and to everyone who's here to show support for the Million Hearts Initiative. And I want to tip my hat especially to Dr. Janet Wright. I'm so grateful to you, Janet, for taking this on. You're just the leader this program needs, and we're going to be behind you every step of the way. Heart disease and stroke, as you've heard, impacts everybody in this country. It touches us all. And the good news is that we can do something about it. With this ambitious 5-year Million Hearts Initiative, we will. It is totally consistent with the overall strategy of the agency that I get to lead, Centers for Medicare and Medicaid Services. We are aiming for better health care, and lower costs through improvement, and Million Hearts echoes in all three of those very important aims. It focuses on assuring timely, lower cost prevention of heart attacks and strokes for all Americans. The science is ready for prime time. Tom's been a leader in showing us that. It tells us how to get the results that we all want, and we are ready. I'm really proud that CMS is joining as a full partner in this effort. We will use every tool available to us. We will use incentives, helpful incentives like our quality measurement and reporting system, which will continually refocus on the Million Hearts ABCs, in addition of appropriate measures to the core measurement sets for Medicaid adult quality measures. We'll focus information technology efforts on this with the adoption of the meaningful use criteria and certified electronic health record technologies. We will help to better monitor hypertension and cholesterol and other targets of cardiovascular prevention. And we will create and support healthcare networks all over this country to help everyone rapidly reproduce results all over the nation, including, for example, our wonderful network of quality improvement organizations, 53 organizations that represent a national force for spread of change. This brings me to some exciting news for the Medicaid programs related to Million Hearts. This morning we are announcing 10 states that are selected to receive a total of $85 million in grants that are awarded under the statutory provision for Medicaid incentives for prevention of chronic diseases. That's a program that will give grants to support programs targeting smoking cessation, weight reduction, diabetes, blood pressure management, and cholesterol reduction to improve heart health and cardiovascular outcomes for our millions of beneficiaries, customized to the intentions of each of the 10 state awardees. Overall, CMS is expanding the level of our interest in prevention, our investment in that, and in risk reduction assistance that we want to offer to all of our beneficiaries and indeed to all Americans. We'll continue to encourage our beneficiaries to take full advantage of the expanded recommended preventive benefits and annual wellness visits that are now available to them at no out-of-pocket costs, so that they can regularly talk to their physicians and nurses about the care that they need. The Million Hearts Initiative, to me, is related to its sibling initiative on prevention, the Partnership for Patients, which is all about partnership also, working together for a common aim. Our aim is simple. We're going to combat heart disease and stroke for everybody. To get there, we're going to have to harness every aid, every lever that we have, better measurement, better health information technology, better innovation, better care innovations, stronger population-based efforts for the benefit of those we all serve. The partnership you see here today, this array of people linking public and private leadership in this effort, including healthcare providers, insurers, employers, community organizations, many others, it's the coalition, the partnership that puts these goals within our reach. At this scale, with this level of ambition, every single person in this room is, without doubt, going to know somebody, a loved one, a friend, maybe even yourself, who will gain from this call, someone who will not have a disabling stroke or a life-threatening heart attack, and who will therefore live a fuller and more active and more joyous life because of what begins here, now. All of us can make achieving the ambitious Million Hearts goals possible, and we in CMS look forward to working very closely with all of you partners and communities around the country to make this happen. Thanks again for coming and for your support. With that, let me turn this over proudly to my friend Nancy Brown, CEO of the American Heart Association.
Well, good morning. We at the American Heart Association are so proud to be part of the Million Hearts initiatives. I stand here before you today representing 22.5 million volunteers and supporters that make up the American Heart Association, the nation's oldest and largest voluntary health organization dedicated to fighting cardiovascular diseases and stroke. And we do that through working to achieve the mission of the American Heart Association, which is to build healthier lives free of cardiovascular diseases and stroke. And I think hopefully all of you were struck, as I was in watching the video, by the faces of the people that these diseases impact every day. And we heard Don and Secretary Sebelius mention the fact that cardiovascular disease takes such a toll on people that we know and people that we love. And this is what we dedicate ourselves to every day at the American Heart Association, people just like the people in those videos. And we're so delighted that Million Hearts will bring together an unprecedented group of partners to help take these efforts to the next level. The 2010 Patient Protection and Affordable Care Act has numerous aspects providing the health community with a unique opportunity to reduce cardiovascular disease and chronic diseases by elevating the importance of clinical and population-based prevention. Moving prevention toward the mainstream of health may be one of the most important and lasting legacies of healthcare reform. That is one of the reasons that I'm so encouraged by the launch of the Million Hearts initiative here today. This bold new commitment to prevent 1 million heart attacks and strokes in the next 5 years represents an unprecedented collaboration among federal agencies, healthcare providers, community organizations, and the private sector. The American Heart Association, as I said, is so proud to be a partner, and we're excited about the opportunity to contribute many of the resources that we've created over time as we work toward this same journey. For example, we're excited to commit the science and the research expertise and our programs that can help reach millions of people through the Million Hearts initiatives. We're excited that the American Heart Association's My Life Check, which is a simple online tool that helps Americans be better informed about their risk and what they can do to improve their own heart health, will be a cornerstone of the Million Hearts initiatives. And through the Guideline Advantage and other American Heart Association health quality care improvement programs, we plan to work closely with Million Hearts to harmonize and integrate where possible evidence-based performance measures to ensure that we are achieving the goal of improving clinical care. The American Heart Association is also dedicated to reducing Americans' daily intake of sodium. You heard Dr. Frieden reference the alarming concern we have about the tremendous sodium consumption of people in this country. And at the American Heart Association, this is one of our major priorities because we recognize that increased sodium consumption increases risk for stroke, heart attacks, and kidney disease. And through Million Hearts and elsewhere, we look forward to continuing to share our science, our programs, and all of our efforts to bring together stakeholders to reduce sodium consumption in this country. Million Hearts brings cardiovascular disease prevention to the forefront of health federal policy and challenges all of us to demonstrate how we can improve the nation's healthcare system to have a dramatic and sustained impact on heart disease and stroke in this country. The lessons learned here can also serve as a model for addressing other chronic conditions. The American Heart Association again applauds the Secretary, Tom and Don, for their tremendous leadership in pulling Million Hearts together. We look forward to working closely with our friend and colleague, Janet Wright, to give this initiative all we have to make it a great success now and in the future. Thank you. And it is my pleasure now to introduce Jonathan Lever, who is here today representing a wonderful organization, the YMCA. Thank you.
Good morning. I'd like to thank Secretary Sebelius and Dr. Frieden for involving the Y in this bold initiative and for the 8-year partnership we have had with the CDC. So thank you. We are proud and committed to helping you reach your ambitious goal and confident that we can help you achieve it. At the Y, we know that we cannot change health in America, but we believe that health in America cannot be changed without the Y. With nearly 60% of U.S. households within 3 miles of a YMCA, a presence in 10,000 communities nationwide, and nearly 160 years of promoting health and well-being, the Y is an unmatched community resource for preventing chronic disease. And we know that the root causes of most chronic diseases are unhealthy behaviors, such as physical inactivity, unhealthy eating, and tobacco use. And what we can contribute to this important effort is that we can engage individuals in programs and communities in policy change efforts to address these root causes. Our commitment today to Million Hearts is focused on increasing the availability of the YMCA's Diabetes Prevention Program, which is part of the CDC-led National Diabetes Prevention Program, and expanding our healthier community efforts. Now, you might be wondering why our commitment to Million Hearts would include a diabetes prevention program. Well, type 2 diabetes is a major risk factor for cardiovascular disease. People with diabetes are twice as likely to have heart disease or a stroke than those who do not have it. The American Diabetes Association says that 2 of 3 people with type 2 diabetes will die of heart disease or stroke. In addition, the behaviors that have been proven to reduce diabetes risk, increased physical activity and moderate weight loss, also have an impact on lowering blood pressure and cholesterol. In fact, 30% of the participants in the original NIH study, the National Diabetes Prevention Program trial, the one that the YMCA's Diabetes Prevention Program is based on, avoided being prescribed medicine for high blood pressure, and 25% avoided anti-cholesterol medication. And people with diabetes involved in this intervention reduced their incidence of diabetes by 58%. So you can see the steps a person might take to reduce diabetes risk are often the same as what they would do to reduce risks for heart disease. Over the past 2 years, with the support of CDC, United Health Group, and a growing number of employers and payers, we've expanded the YMCA's Diabetes Prevention Program from 1 Y in 1 state to 43 Ys in 22 states, delivering the program in hundreds of locations. While we know that the programs such as the YMCA's Diabetes Prevention Program are important, we have to acknowledge that not everyone will enroll in such a program. So at the Y, we're equally committed to creating healthier environments so people can find healthy food options, have opportunities for physical activity, and breathe smoke-free air. Our Healthier Communities, now in hundreds of communities, brings together community leaders to influence policy systems and environmental change strategies to make the healthy choice the easy choice. To date, we have cataloged more than 14,500 strategies that communities have implemented to make it easier for people to live healthy lifestyles. These include bringing farmers markets with fresh fruits and vegetables to neighborhoods where food options are scarce, improving vending options in work sites, making roads safer for users whether they walk or they bike or they drive, and creating smoke-free parks, work sites, and other public spaces. Through this dual strategy at both the individual and community levels, we look forward to reaching the ambitious goals of Million Hearts. Thank you very much. Pleased to introduce Kermit Crawford from Walgreens.
Good morning. On behalf of the over 244,000 employees and 26,000 healthcare professionals at Walgreens, I am so pleased to be here, Madam Secretary, and help HHS launch the Million Hearts Initiative. As the nation's largest community pharmacy, we at Walgreens support patients and their loved ones every day as they struggle with chronic diseases and trying to manage their medication, adherence to their medication therapy. That's why Million Hearts is a perfect partnership for Walgreens. Million Hearts sets out to prevent cardiovascular disease and stroke through a focus on managing risk factors associated with high blood pressure, cholesterol, and smoking. Walgreens is dedicated to similar goals of prevention, access to quality care, and lowering the overall cost of health care. For us, the work is the essence of community pharmacy. Over the last several years, we have worked diligently to transform community pharmacy from focusing more on a transaction of filling prescriptions to putting a real focus around the critical relationship of our pharmacists and their patients. To get that emphasis right, we have ensured our pharmacists have enough time to consult with our patients by enhancing and improving the way that we run our stores and design our physical plants. As we have improved our efficiency, we have been able to add new services, such as flu shots and immunizations. Last year, we delivered more than 6.4 million flu shots to all of our patients, making us the single largest provider of flu shots in the country after the U.S. government. We are promoting screenings for high blood pressure, diabetes, and other prevalent chronic conditions to ensure our patients get the care that they need. Our expanded products and services, which are available at nearly all of our 7,700 drugstores and take care clinics, are helping to fill the gap in care that are a simple reality in today's healthcare system. And because we already have this network of care in place, we are ready to support the million hearts. To drive home our commitment, we are announcing today that we will engage our more than 26,000 healthcare professionals to support the million heart prevention goal by providing blood pressure testing at no charge in all of our Walgreens and Take Care clinics, along with consultations with our pharmacists and nurse practitioners. In addition, we will also promote diabetes testing during the month of November, heart health during the month of February, and make million heart resources available at all of our drugstores across the country. We are very pleased to bring our industry leadership and market reach together with HHS to launch this program today and make it meaningful to our patients throughout the remainder of the year. We're truly proud to be involved in this initiative and look forward to continuing to support HHS and our patients to live well, stay well, and feel well. So thank you. Don?
Thank you very much. You've heard from three of us in the public sector and three in the private sector. This is just really a sampling of the commitment, dedication, innovation, and creativity that's being dedicated to preventing 1 million heart attacks and strokes over the next 5 years. Different parts of the federal government, including other parts of Health and Human Services, ranging from the Office of the National Coordinator for Health IT, to the Agency for Healthcare Research and Quality, to the NIH, to the SAMHSA on mental health services, are equally committed to prioritizing cardiovascular prevention. And you have in your packets a long list of some of the initial partners and what they are committing to do to prevent 1 million heart attacks and strokes over the next 5 years. This is truly an exciting and unprecedented public-private partnership to reduce heart attacks and strokes. We now have time for a few questions, and we have, I think, people with microphones on either side of the room. If you raise your hand, be delighted to direct them to the appropriate person. Question here?
Hi, thank you for coming here today and announcing this wonderful initiative. There's been increasing research and media attention on the role of plant-based diet on reducing heart disease, and I was just wondering if you could talk about that for a few minutes.
The focus in Million Hearts is to scale up the known interventions that we're confident will make a big difference. Changing diet can make a huge difference for individuals, and programs like the Diabetes Prevention Program enable individuals to do that, as our colleague mentioned from the YMCA. I think, though, what we are looking at here is what are the things that we can do today that can be rapidly scaled up, both in prevention and in treatment. And one of those focuses is the ABCs. Of course, increasing plants in your diet and reducing saturated fats will have many advantages. And this is one of the things that people can do to live a longer, healthier life. I'm not sure if anyone would like to say more about this issue. Nancy?
You know, certainly at the American Heart Association, we think a lot about nutrition and the diet in an individual's lifestyle. And one of the things we recognize, as Tom just said, is reducing intake of saturated fat and increasing foods that are high in whole grains and other plants, fruits and vegetables, et cetera, is positive. But the thing that we look at when you look at the entire American population is that we need to help people also make incremental changes to improve their diet and improve their health. It is hard to imagine when you look at the population today that you could move people from the kind of diet they're consuming today to a completely plant-based diet. And I think the things that you're referencing that have been in the media have suggested that that might be a way to reduce cardiovascular disease. So we are committed to helping people make important changes in their diet that include lower sodium, lower intake of saturated fat, increasing fruits and vegetables and whole grains to move them to health. But that the radical change from a diet today to a complete plant-based diet is probably not realistic for the population as a whole.
Next question. Question here.
Thank you for the button of our hearts. And I would like to ask a question. What specific strategies, intervention do you have in mind to address obesity as a contributing factor, as we know, among the underserved, the low-income, marginalized population in this country, such as the Latino population?
Secretary Sebelius?
Well, it's a great question, and there's no question that not only is obesity a problem and a concern across the board, it's a real crisis with our children. And, you know, when you have 1 out of every 3 children who is either overweight or obese, and we're on trend to have that increase year in and year out, and as you say, the underserved populations show even higher rates. So it's a double concern. There are a number of strategies already underway that have tried to address this program, everything from trying to make fresh fruits and vegetables more available in minority communities and in underserved communities where often there are miles to go to get to a full-service grocery store, to changing the nutrition programs in schools where a lot of our kids get a lot of their calories and a lot of their food. So the update of the new school-based lunch and breakfast programs is a big step forward, more focus in that area. Reintroducing physical education in school is another significant component because we know that kids who have physical activity. We have a broad-based prevention strategy, which again is aimed at a lot of community initiatives and involves our partners at the Department of Transportation who are looking at walking and biking paths, housing and urban development to make sure that there are playgrounds and spaces available as they develop housing complexes. So I'd say this is a multi-part strategy that really is looking at various programs. A significant part of the Affordable Care Act, frankly, is providing health coverage for a lot of the underserved population who currently now have no insurance and have no ability to get help from prevention strategies. We're also doubling the number of community health centers across the country, which often are in communities with the most underserved population. So there are a number of things going on already. That's kind of the government footprint. I'd say the private sector is also involved in this kind of partnership effort. I met yesterday with members of key representatives of the food industry who are already at work voluntarily reformulating a lot of their products, looking at ways we can partner on sodium and sugar to reduce the amounts that are processed into foods, looking at ways that they can do better labeling so consumers will have more choices. But I think it's both an education and a kind of empowerment, giving consumers not only information, but giving them choices that are available, affordable, and healthier.
Jonathan, do you want to add anything to that?
Yeah, I would just add in our little corner of the world at the Y, we are really trying to expand the diabetes prevention program that I mentioned into federally qualified health centers. So the program that I mentioned, you may all have been visualizing people coming to the Y. Actually, the program, in many cases, the Y can go to the program and can be offered in a church basement wherever, because it is a group-based program that's really around a table. So that's one of our strategies, and our Healthier Communities efforts that we have support from CDC, really focusing on those neighborhoods when we bring community leaders together, making sure we're bringing together the communities that need our assistance the most, where the policy systems changes are the most intractable, but we need the most resources. So we're trying to do our little part both on the program side and in the community as well on the very issue that you raised.
Thank you. Kermit Crawford?
Yeah, I'd just like to add, at Walgreens, almost 40% of our stores are located in the MUAs, the medically underserved areas. And what you find in most of these underserved areas is also what we've kind of described as a food desert. So just like you're talking about, there's not the availability of fresh foods and vegetables. And we've started a program with Mayor Rahm Emanuel in Chicago and the state of Illinois, putting in our food oasis stores in these medically underserved areas, so that we're able to provide fresh food, fruits, and vegetables to those areas to keep you from having to eat just the snack foods that you see in a lot of those stores.
Dr. Watt?
Thank you. The American Medical Association is really trying to arm our physicians to make sure that when patients come into our office, we provide them with the best possible information as well. I should mention that we have a program called an AMA Healthier Life Steps that includes not just diet, but also tobacco cessation and other things that people can do in their lives to help prevent diseases before they actually happen to them. Our president, Peter Carmel, this year has made his presidential initiative to tackle the obesity epidemic that's facing the country, and the huge dollar impact that that has on our healthcare system, and more importantly, the impact that it has on everyone's lives. We're going to send out kits to physicians' offices that will provide posters, information pamphlets, checklists for physicians and nurses that see patients to make sure we're getting the information out to our patients, that they understand the impact of their diet and their activity levels on their healthcare.
Thank you. Dr. Reed Toxin from United Health
Just to
Group.
continue this theme of partnership, all of us putting our shoulder to the wheel together for this, and this is a great question that sort of gives us a chance on the stage to sort of indicate how it all adds up together. What we're doing at United Health Group and our foundation is we've been adopting school systems around the country, and in particular, we've got 3 states, 6 school systems that we've started with, which have a significant number of Hispanic students. And what we've been doing is to focus on training school nurses to help them to be able to be better at what they're doing for diagnosing children who are at risk, working to counsel children, and to refer them to wonderful places like the Y as a great example. And what we're also finding is that the school nurses need and deserve and can benefit from great support in working with the physical education department and the school lunch program, the nutritionists in the school, to be able to be in partnership there for advancing healthier strategies. So that's another one way in which we're really trying to get at this. And again, if you sort of add up all the things that you've heard, each individual initiative is important in its own right, but it's the combination of all of them that makes the biggest difference.
Tom Milligan?
I can just add on pharmacists' behalf that many pharmacies provide a number of programs, both within medication therapy management, the provision of that, as well as really, if you look at grocery store chains, today are offering food tours, where they'll take their patients around the grocery store and literally show them options of better eating habits and so on. So really mixing the use of medicines and the use of lifestyle changes to get to better health.
Thank you. Also today we are announcing national organizations which will support the Community Transformation Initiative, and later this month we'll be announcing the communities that will receive the first set of Community Transformation Grant Awards funded by the Prevention and Public Health Fund of the Affordable Care Act. We have time for one or at most 2 more questions.
I think this is our last. Hello, I'm Susan Campbell with Women Heart, the National Coalition for Women with Heart Disease. And thank you very much. Especially appreciate having a young woman in the video, because we still have a long way to go to understand that women, it's the #1 killer of women for heart disease. I was wondering, you focused a lot on primary prevention. I was wondering what ideas you had about secondary prevention, since having a heart attack is one of the biggest indicators of having another heart attack or stroke.
Sure. I'll just comment that the number that I cited, that less than half of Americans who should be on an aspirin are on one, actually refers to a community survey of people who have had a heart attack or a stroke or another vascular event. So that is an example of secondary prevention. But Dr. Berwick?
Sure. For the Medicare population, this is especially important because there's so much chronic illness in that population. I'll tell you the number of tools and opportunities we have with the Affordable Care Act and our programs in Medicare to actually improve coordination of care, which is an essential component, essential support to secondary prevention, is enormous. As we see new forms of payment and measurement and accountability emerge, which allow clinicians to do what they want to do, which is to take responsibility for people over time and space, we should see secondary prevention reliability improve a great deal. Many of the metrics that we're introducing in the Medicare Advantage program, in the accountable care organizations that will emerge, and in bundled payment and other forms of the kinds of incentives and supports we can offer, you'll see an emphasis on continuity, coordination of care, which will redound to better secondary prevention. You also know that in the Partnership for Patients, the other major campaign we have, one of the key goals is a 20% reduction in readmissions, and that is exactly related to keeping people healthy and well after they've had their initial episode of illness.
Well, the other feature, Dr. Berwick talks about the Medicare population. You mentioned kind of younger women as a prime target because people are often unaware that they're at risk. And I think there's, one of the hidden benefits of the adoption of electronic records also lends itself to this sort of protocol being monitored. Too often, I think now, not only are the protocol not followed, as Dr. Frieden points out, but there's really no way to monitor that. So one of the things that's happening really across the healthcare system, which is very good news, is both hospitals and doctors' offices are adopting electronic records which will measure and monitor patient care in a much more, I think, disciplined and accountable fashion, and be able really to check and see whether the protocol is really happening, whether or not patients are following cholesterol control strategies, blood pressure reduction issues, the aspirin strategy, the kinds of things that are highly recommended but often not followed. So I think that is a kind of underlying platform which will allow for the first time, with meaningful use and other measurements being tied to the financial incentives, this kind of protocol across the medical field to really be adopted and followed and monitored.
Very brief comments from Nancy and Robert, and then Reed.
Just to add on to the Secretary's comments, that's why we're so pleased that the Guideline Advantage, which is a program that will allow that exact tracking to take place, will be a key component of the Million Hearts Initiative, so we'll be able to make sure the measures are being adopted and followed in the practice setting.
First, I just want to say, as an OBGYN reproductive endocrinologist, I appreciate you bringing up women's important problem with health and heart health here, Carrie. The AMA has actually worked very hard to populate the exact same things that we're hearing. We bring together the consortium to bring together all medical specialties to make sure we have doctor-derived guidelines to take care of health of the heart before and after heart attacks occur, as well as strokes. And the other thing I'd say is that we're looking to merge those into electronic records so that they're, the right thing to do is the easiest thing to do. That's when it becomes much more prevalent. It doesn't become a hindrance or a problem for somebody to use the right thing. And that's what we're really pushing to do, and I hope that that'll advance this secondary as well as the primary preventions.
And let me just continue to carry the ball that my colleagues have stressed. One of the key things around evaluating the quality of care that's delivered and feeding that information back to the delivery system so that they can continue to improve their performance is actually having the data. And as the Secretary has said, and really what's underneath her comments is that usually the way that we have the data today to evaluate performance is administrative claims data. Now what we have the opportunity to do is, especially when it comes to whether aspirin is being used, but certainly blood pressure and tobacco, you need clinical data from the care delivery system itself. There are wonderful partnerships that this initiative is now advancing. For example, I see Jack Lewin in the audience from the American College of Cardiology. We have partnered at United with them to use their registry information where physicians report their behavior to their college, and then we use that as transparent information to feed back to our 650,000 physician network, but also to our customers. So I think another example of how all these people line up. these things line up. And this is what I think leadership is about, and what we see from our federal leaders today is a way of galvanizing all of these initiatives in a focused, coherent package.
And I'd just like to make one quick comment. The most underserved health professional in this country is your community pharmacist. Go and visit your community pharmacist. They can help you with your medication adherence, and what we're talking about is really around adherence of a chronic disease, because we are talking about a chronic condition. And your local pharmacist, the access is there, the quality is there. Go and see your local community pharmacist.
When we look around the U.S., we see many providers, many systems that have had dramatic improvements in preventing heart attacks and strokes. And when you ask the providers, the people on the front lines there, what made the difference, they generally say it was the focus on what's important, it was enabling with IT, and it was getting the whole healthcare team on the same page and involved. And in the field of nutrition and tobacco control around the country, there are also many successes. Million Hearts will knit together those successes in a national commitment to preventing 1 million heart attacks and strokes over the next 5 years, and really be a model for how we can move our system from being a sick care system to a healthcare system. I encourage all of you to visit millionhearts.gov at HHS, millionhearts.gov for more information. I want to thank all of our partners, panelists, and especially all of the organizations and all of the people who work every day to make saving lives a reality. Thank you all very much.